All right, welcome back to the Lightning Step Couch. My name is Benjamin Turner. I am your behavioral health advocate. In this series, we put a spotlight on innovators within behavioral health. This series today, or this episode today, is co-sponsored by Chess Health. Joining us from Chess Health is CEO Hans Morefield. Also joining us is our special guest today, Janelle Wesloh. She is the former Vice President of the East Region and of Clinical Excellence, Innovation, and Recovery Management at Hazelden Betty Ford. And now she works as a consultant for a number of behavioral health programs. Thank you both for joining us today.
Thank you
for
for
having
having
us.
Absolutely. Janelle, really excited to have you join us. Can you give me a little bit background on yourself and what you're currently doing as a consultant?
Certainly. I'm very excited to be here today, and I thank you for having me. And I have been recently semi-retired from a 30-year career directly in substance use disorder and behavioral health with Hazelden Betty Ford. Had a fantastic, amazing career there where I had the opportunity to do so many amazing things, and especially helping patients find their path from treatment to what comes next in recovery management and recovery support. So that is something I'm continuing to do as a consultant, working with other treatment centers and technology companies that are interested in helping patients in that area and providing my expertise and experience as needed to help wherever I can.
Awesome. Thank you so much for that. And today we are talking about building an alumni network for ongoing connection within behavioral health. And that's why we brought Chess Health in today. Hans, can you give us a quick background on Chess Health and your role within them?
Sure, Benjamin. First of all, I'm really pleased to be here today. Really pleased to co-sponsor this event and to bring Janelle's expertise, to the broader audience. So, as you mentioned, I'm the CEO of Chess Health. We're a digital health company focused on substance use disorder. We have solutions for the entire life cycle, from prevention to intervention to recovery support. We don't deliver treatment. We're all about supporting and amplifying the efforts of our partners. And our partners include some fantastic treatment centers of all types all across the United States. And briefly, I'll just mention that the solution that we're best known for and that's sort of relevant to today's topic is called e-recovery, and it's integrated with the Lightning Step EHR. And it's all about supporting individuals who are in treatment and in recovery from substance use disorder, including alumni of residential programs. So we're really excited about supporting alumni efforts of our customers, and we've worked with Janelle and really think she's going to bring some great expertise to today's discussion.
Awesome. Thanks, Hans. I appreciate that detail. And we're recognizing more and more the need and the benefits of a really strong alumni program and what that can do for people in recovery, keeping them in recovery, adding to a community of recovery and support. So I want to jump right into a few questions, Janelle, if you don't mind. How has the implementation and workflow when it comes to Chess Health, how does that impacted staff and admin, the burden or the organizational flow? Can you speak to that?
I can. Actually, I have worked with an organization that implemented Chess Health. And the nice thing about implementing something like Chess Health is a lot of it is out of the box, I would say. Chess Health provides the resources necessary to make it a very smooth implementation. They have all kinds of templates and tools and people who are dedicated to your facility to help make it as smooth as possible and to make it as least resource intense as possible. As we know, resources are scarce and we have to utilize them in the best ways possible. So implementing something like Chess Health is really one way you can really maximize the use of your resources to make sure that your alumni have a really robust platform and place to have social interaction and build that community, and have people who are kind of keeping an eye on things in case things aren't going well so they can quickly intervene and get you back on track, rather than have someone start that spiral to where they are really struggling and might need to go back to treatment again.
Absolutely. And you touched on it a little bit there, and in my intro there, we touched on it too, but tell me a little bit more about why Building an alumni network is so valuable for treatment centers and clients. Can you expand on that a little bit more?
It's one of my favorite questions, so yes, I can. There's actually two kind of columns I like to focus on when I talk about why it's so important to have a robust alumni network and planning and programming. One of them, of course, is about our patients and making sure our patients do well as they transition from treatment and go back to home or wherever they're going to go. Having a support and a lifeline and a safety net for them as they make that transition is so critical. Just like any other chronic illness, you don't just do the hospitalization and send them home and say good luck. They have to understand where they can get support and tools and education and know what to do when things aren't going right or aren't going as well as they'd hope they'd go. So having that support during that critical transition time is so critical. So building the different things to help the alumni during that time is key. And there's different tools that are needed for different alumni. If you have someone who's 80 years old and going back to rural America, they may not jump onto an app or a platform. They may need something different. Or you have a millennial who they've grown up with technology and they really want to grab onto something that's easy and that fits into their life when they want it to fit in. So there needs to be different tools and different solutions depending on the person and where they're at. So keeping people engaged with the treatment center so they can intervene quickly and also keep them in a community that's supportive is that kind of patient-centered reason why we do all the alumni things we do. But there's also a business reason why we do it as well. I consider it secondary to those patient reasons, but there is an actual kind of return on investment on this as well. Number one, engaged alumni will go out and talk about your treatment center and what great work they did. So they become their own, they become your own ambassadors for your treatment center, and they do marketing for you, and for lack of a better term. They go out there and say, this was great. Not only did I get good treatment, I have all these tools that are helping me stay connected now, and that really helps me stay sober. So they become your ambassadors. That also leads to reference. They have people they know that are still struggling with their use and their issues, and they're going to say, hey, you know where you should go? You should go to this treatment center because, again, I got great care, I have all this great support, and I think this is a great place for you. For programs that are nonprofit, they also sometimes are so grateful they become donors.
Yeah.
So that's another key thing that's super important. So you have all of those things. They also, can learn about the different programs and services you offer after treatment. And again, they might come back for retreats or reunions or things like that. So there is a return on investment, both in direct and indirect revenue, when you keep your alumni engaged and part of your treatment center. So there's the mission part and the margin part, and it all comes together in making sure you have a really strong alumni network.
Absolutely. And that's so important for facility owners to understand about the benefits of the alumni. Again, not only for the client patient themselves, but for their business. There's really some positivity there. Can you talk about outcomes and what outcomes typically improve when there is a strong alumni network?
Well, one of the things I've seen, especially as our field is moving away for fee-for-service and moving into value-based care, we're looking at things like pay for performance, where our payers are saying, show me that you have a quality product that we are then going to send our patients to. And things that can be measured if you stay connected with your alumni is, kind of simple things like per number of days, percent days abstinent, number of days abstinent, those are important. But how long someone stays engaged, how often you do outreach and call or connect with your alumni are things that our insurance companies are looking for, because they know that stretched out engagement and that staying with them and helping them create that community and staying out of isolation increases the chances that they won't return to use and therefore return to treatment or the higher levels of treatment like detox or residential. So if we can stay engaged with folks and we can intervene early if they struggle or keep them supported so they just are doing great, those are things that directly tie into that pay for performance and that value-based kind of platforms we're moving towards, and away from that fee for service where it was just, okay, they struggle, they go back to detox, they struggle, they go back to detox. Nobody wins in that scenario. So having these strong platforms and measuring how those work benefits the patient, the providers, and the insurance companies and payers. So it's a win-win all the way around.
Yeah, it sure sounds like it, and that's amazing. This next question can be posed to both Janelle and Hans. What are some current strategies outside of Chess Health maybe that are being used to engage alumni? And what are the limitations in some of these current strategies?
You want me to take that?
Yeah,
or do you want it?
whoever jumps first.
But you know
go for
what?
it.
Why don't you take it first and
Okay.
Yeah.
Awesome. So I kind of, again, divide these up into two categories as well. There's your in-person options, and then there's your virtual options. So in-person options are things that treatment centers have been doing for eons. You know, we have reunions, we have celebrations, we have different kinds of support programs. You may have chapter meetings at key geographic locations where you know your alumni are clustered, so that you can have support and you can go do fun activities. If you can't find things that are fun in recovery, the odds that you'll stay in recovery start to really diminish. So being able to have that social support, have a fun group of community and that fellowship, and do fun things together, you know, so those are really key, and those kind of in-person kind of events. But the cool thing, and I think really got just blasted during the COVID era, was really learning how to do all these things regardless of geography, which was amazing. And so that led us to being able to do even more things and expediting and really speeding up some of the things that might have just been starting pre-COVID, like virtual treatment. That was just getting started before COVID, and it was done in very small pockets. When COVID hit, it just expanded exponentially because it was really one of the only options. And we needed to still be helping patients, but how do you do it when you shouldn't really be sitting in a room together? So that really blew up how we got together virtually and made it feel like this feels today. Like I can feel like we're not that far apart. We're almost feeling like we're in the same room together. So that's what I think is really exciting about what's happening now, is the ways we can just, you know, getting together face to face is fantastic and it's important, but we can always augment it and add all these virtual options that fit into people's lifestyles better, regardless of geography, time zone changes and differences, whether there's a pandemic going on or not. These things just kind of all go to the side, and we can stay connected and work together in things like apps, platforms, social platforms, things like text messaging, and things that are really starting to pop, like how to use artificial intelligence in all of this. How do we, you know, pick through what people are saying and say, oh my gosh, these are risk factors we need to.
Oh no,
get
we may have,
not call every single person every single month.
Right.
You know,
yeah,
really
we lost you
these
for
things
just
up.
a moment. We lost you for just a moment, but I think
Yeah.
we got the most of that. Hans, do you want to jump in?
Yeah, so Janelle articulated some of the options, you know, including obviously bringing people together for in-person events. So the challenges, of course, with some of these sort of alternative options or traditional options, one is that, you know, not everyone can come back for reunions. And by the way, reunions might be once a year, and there are 364 other days of the year that you want to engage with people. So the other thing that some of the, you know, some organizations out there are thinking of or are doing is saying, oh, well, why don't we just create a Facebook group? We'll just do social and alumni connections in Facebook. And at first, that might seem like, hey, what could go wrong? But the reality is, and we've had a number of organizations come to us after starting, you know, on Facebook, is that one, Facebook's not anonymous. And so individuals, not everyone's really comfortable in using that kind of platform because, you know, their anonymity, it's not a safe, necessarily anonymous place to communicate. And secondly, it's not an environment that providers can control. And so really one of the risks of using existing social media platforms is that they're out of control of a treatment provider. And sometimes it's really important to be able to control that discussion and to be able to facilitate it. And sometimes to recognize that there are individuals who could benefit from reading the conversation, but maybe shouldn't be posting and commenting so much. And so in our kind of platform, we provide that kind of those discussion forums that are incredibly, you know, supportive. And one of the things that Janelle alluded to is Chess has its own team of peer recovery support specialists who moderate them 24 hours a day, 7 days a week. So they never go, you know, into a sort of a dark place. They're always positive and supportive. We can help individuals who are struggling. but we're making sure it's always a safe and supportive environment. And treatment providers can't control, those Facebook and Twitter sites the same way. So that's one of the risks of sort of the alternative of like, let me just do this in Facebook. And then the other challenge is, again, not everyone can get to things. People really benefit from meetings. We run meetings through the app. We can host those kinds of large virtual groups, but again, sort of managed and controlled by the treatment provider. And maybe the last thing I'd point out is Janelle even mentioned text messaging, right? Having an alumni coordinator who's sitting there and text messaging alumni. Well, they end up doing it from their phone. And then the alumni coordinator leaves and, the facilities completely lost track of, well, what were all those conversations? And so we provide the platform for all of that to happen so that the really controlled content, controlled messaging, and controlled social communications.
Yeah, those are some excellent points to make. And what could go wrong? Well, we've learned what could go wrong, and that's why we've developed, why you guys have worked so hard on Chest Health and creating this type of platform. So I appreciate that input as well. I want to move a little bit further onto the resources needed in terms of staff time, technology, et cetera, that are required to build a robust alumni community.
Janelle, you want to start?
I'll start with the
Yeah.
traditional kind of,
Yeah.
there's many different ways you can do it. One of which is you can have dedicated staff at a facility. Now, we know that resources are scarce and that becomes difficult. And one of the things that tends to happen is sometimes that ebbs and flows. You might start off with having, being really excited about having a staff that's really going to take care of your alumni. And that may, at some points need to be, trimmed or raised or expanded. So those kind of things tend to happen. But so having dedicated staff is one thing, but that's kind of a pro and con to that. The other thing that's important to know is even those dedicated staff don't have to be licensed clinicians. We're talking about support here, not therapy. So we're looking at, peer, like the peer support specialists that Chest uses. It does not have to be, your therapist that is monitoring, something 24/7. It can be someone who is in recovery themselves, someone who's one of your own alumni that maybe just has a little bit of training and oversight. So that's another way it can be done that is a little more cost effective, is to have alumni volunteers who are going to potentially, monitor something or run an event or plan an event. I mean, if you're looking at both sides of the in-person and the virtual. So you can do it a lot of different ways depending on what your facility is able to do with resources. And it can be anywhere from, kind of the more traditional approach where you have, a suite of dedicated staff, to potentially having a staff member who that's part of their job, and then they just kind of jump in when they can. Maybe someone who helps set up continuing care plans, also helps run your alumni network. Or you can look at how you can utilize your alumni volunteers in a way that can really take on the vast majority of the efforts, and then just have a facility resource really look over it. Now, when I've seen programs like Chest come into play, that is a huge sense of relief sometimes for facilities, because they do provide those staff and they work so closely with the facility staff to make that really smooth and seamless. And so that's yet another option, is to kind of resource that out to someone else, like a Chest Health, so they take care of it for you, but still stay connected with the facility staff to make sure that if something is not going well, or something, it doesn't seem like it's working quite right, they're very quick to say, let's sit down, figure that out, and make sure it's smooth. And in implementations I've seen with Chest Health, that's been done very, very well. And I'll let Hans talk more about that side of it.
Yeah,
Yeah,
I'll just
go ahead, Hans. Yeah, absolutely.
Yeah.
Jump right in.
I'd make the comment that in a way, with a platform like ours, an organization can offload some of the responsibility. Like the minimum requirement that we would encourage is that, that a facility is a that everyone across the organizations, and what we would consider an alumni champion and an app champion, that they're encouraging individuals to say, hey, when you leave, and we'll talk in a moment maybe about when people get the app, but when you leave, you should use our alumni app. And so the role of the facility can just be to encourage its use. And then when individuals do leave and start to use the app, the actual day-to-day use is being, managed and moderated and supported by the chess team. And that's not a responsibility that falls back on the facility. But whenever we see an issue with an individual and we provide them one-to-one support because they're struggling, we're also going to report back to the facility, the support that we gave to their alumni, because sometimes those individuals do need to return to treatment. And so we can help to facilitate reconnecting them with treatment if necessary. One other point I'll just make also is we've been talking a lot about alumni today, but those alumni often become, go to a PHP program and an IOP program, sometimes from the same facility, right? A lot of facilities are investing, and individuals benefit from having this app while they're in PHP and in IOP and in regular outpatient, because the support they get between visits extends their adherence in outpatient treatment, which is a benefit to their long-term recovery and a benefit to the revenue that a facility is trying to generate from those services.
Absolutely. And I think that's a great point to highlight is the lift of resources that Chest Health can help with in a facility by taking that burden on or reducing some of that burden that might be internalized now and hard to keep. Like you had said, somebody may be taking those calls or texts on their cell phone, they leave the organization and and there's no real follow-up. So it's really important to highlight how Chest Health can do that.
Yeah, and by the way, we're really pleased with the integration we have with the Lightning Step EHR. All a staff person has to do is say, hey, there's a great app for you, and click a single button in the EHR, and the individual's been invited to get the app. So
let's talk about that. When does that happen? When does the patient or the client get the app? How do they get it? What's that timeline look like?
Sure. So I'll start this time and then invite Janelle to add a little bit. But I think it's going to be interesting how Janelle's seen it evolve. See, when, 5 years ago, we would have said, okay, well, everyone's going to get the app when they leave. They're going to get it maybe during discharge. Maybe they're going to get an invitation after they've gone home. They're going to get an email or something like that. And we certainly still see some of that. But I think our most innovative customers are actually giving the app to residential patients during residential treatment. 2 of our locations give it to them on their 7th day. So on their day 7, they're downloading the app, they're starting to use it, they have access to their smartphone during treatment. And we've even had at least one case, it was really clear to me, and it was shared to me by one of my customers, where their CEO was, the person had reported on day 10 or day 11, they said, I'm sitting in this facility and I'm thinking of walking. They posted this in one of our discussion forums. Like, I'm thinking of walking out, and I've done that before. They were contemplating AMA, and they got tremendous support from the community and from our peer team. And behind the scenes, we contacted the facility because we're providing sort of one-to-one. We let the facility know. They were able to engage the individual. The individual completed treatment, and they completed their entire PHP IOP program. So, it's we also see a great long-term engagement once those individuals have been starting to use it, so early in residential treatment. So that's sort of the best practice that we're seeing today. But sometimes it's, again, traditional, like it's at discharge. Janelle, is there anything you want to add?
Well, it really shows some of the shift that we've seen in the treatment industry, where it used to be you were in residential, you would no way have your phone in residential treatment. And a lot of, like Hans said, the more innovative treatment centers have realized that at some point, maybe from the beginning, maybe some point during that cycle of care, it's going to be important for patients to figure out how to start using their phone for recovery rather than for their addiction. Right. So having them get something like a chess app on their phone during care, so they can start learning how to fill those spaces that used to be filled by dealers and other things in their phone. Now I'm putting healthy things on my phone, like the chess app. I'm starting to reach out and build my community before I leave. If we wait until the end of treatment to do all those things, the transition time is one of the most dangerous times for patients. If we already have the safety net set up for them, they already know how to use it, it's on their phone, I already have a community, I know I can reach out, that takes that most dangerous time and really makes it have a lot more kind of safety and different options available to them. So if they start to struggle, that they can quickly reach out and get help. So I think what Hans and what Chest Health has really been encouraging treatment centers to do with using it during care, so they can start practicing these new behaviors, these new ways of filling their times, and the new communities that I'm now going to be part of. It really fits in with what we know, that, keeping patients from feeling isolated as they're leaving and feeling like I have to leave all these, I may have to leave all these friends because they're still using. What am I going to do now? It starts to fill in those gaps so it doesn't feel quite so isolating and alone during that transition and moving on, because they already have some of these really important things in place as they're moving away. Now, the other thing I'll add is some people don't do residential treatment at all. They start at partial hospitalization. They start at intensive outpatient. And then it's even more important, because they're in their home environment, to not only have that time that they're in care, but they have all these other hours that now they're practicing the things they're learning, and having those supports in place, like Chest Health and other recovery supports, is key. So regardless of the level of care, I think all of these things become just critical and so important.
Yeah, what a powerful example of the power that Chest Health has, and getting it in their hands earlier, and having access to it. I would have never thought about putting it in their hands during the recovery process, and how beneficial that can be. And so we talk about in the recovery or in a residential treatment plan. Let's expand on that a little bit more and talk about how we can implement this alumni community in inpatient or outpatient situations.
Well, Janelle already brought up the conversation about using the concept of the hours between. And we really do, most people who use our app are in outpatient treatment at some level. And, outpatient treatments where most individuals are going to spend most of their time in their recovery journey. And there are huge gaps in that treatment journey. And the gap is the time between visits. So imagine someone who's in outpatient treatment goes into their clinic, goes to the provider, they go in on a Tuesday afternoon, they have a visit with their therapist. Maybe if they're on medication-assisted treatment, they get their meds renewed. And then they walk out the door, and it's 167 hours until their next weekly visit. And in that 167 hours, they're generally unsupported. Now, we would love for them to go to meetings, and meetings are fantastic, but that might only be a couple of hours in that 167. And so the purpose of our app in that scenario is to give individuals recovery support. And sometimes it just starts in the form of distraction, right? That gives them something to do, but it also gives them community. It reduces their loneliness because they're connecting with real other human beings, their peers, in this safe forum. But if they have risk moments, they're going to get support. They're going to build up their skills. And if necessary, there's a whole peer team, 24 hours a day, 7 days a week, to get them through those severe risk moments, so that our goal is next Tuesday afternoon, they walk back through the door and they get their next visit. That's success to us. People staying in treatment. The longer they stay in treatment, the better their long-term outcomes. The longer they stay in treatment, of course, also beneficial to the treatment provider.
Absolutely. You had mentioned the integration with Lightning Step and Chest Health. I want to talk a little bit more about that, and just how can an integrated platform with embedded peer support, like what we have with Lightning Step and Chest Health, how can that facilitate an ongoing support community and alumni engagement?
Yeah, Janelle, do you want me to? Well, I can start a little bit, and then Janelle, you can add. So, right, the whole first point is that the facility can focus, on providing great care, on making and doing that as well as possible, and the staff can focus and say, you know what, I know that I come in and I've got work to do from 9 to 5 or whatever my hours are, and I'm going to support the individuals that are in front of me, and I'm not going to have as many outside messages and demands coming in for recovery support and crisis support from my patients who I saw yesterday, because they have another avenue to get that support. So part of what we enable is that facility to focus on providing treatment really well, during its hours, in its location, knowing that its clients and patients are getting support when they're off-site from a dedicated team that's staffed 24/7, that's supervised 24/7, that's going to help its clients and patients, but without adding burden to, that clinical staff that is, short-staffed and on edge. So we take a lot of burden off, and then at the same time, we're keeping census high. So that's how we think we integrate well and support well, what that provider's trying to do every day.
Absolutely. Janelle, is there anything you wanted to add to that, or did you think he summed it up pretty
No,
well?
that's perfect. That's
Yeah.
exactly right. I
And
see
you
this day, I
mentioned,
saw this day in and day out. It's perfect.
yeah, and you mentioned staff burnout, being able to just lift one other thing off of the staff and the clinicians and what they're burdened with every day can help retain those great staff members and just alleviate that stress and burden that they have with their already high demands within the facility. Being able to pull one thing away from them can be incredibly beneficial. And to talk a little bit more about that within the facility, what kind of metrics are measurable and trackable when it comes to alumni engagement over time?
Well, there's quite a few, I mean, if you look at the vast variety of things you can do with alumni to keep them engaged, it might be as simple as, how many different things do people go to? I mean, as simple as that. But when you start to look at online things, platforms, you can look at things as simple as number of logins. There was a platform I helped implement at one of the places at where I worked, where we did some research. We started out doing research on how much content someone had consumed within this platform, and then and we saw the correlation between the better outcomes and how much content. And then we thought, well, let's take it back a step and say just the act of logging in, did that change the outcome? And it did. And so just the simple act of logging in, not necessarily even, consuming a piece of content, or maybe they're just lurking in one of the discussion groups and not necessarily even saying anything. Just the act of doing something proactive for their recovery, like logging into a platform or doing something like that, increases outcomes. So and then it just, of course, expands from there. So we know that even just getting somebody to give it a try is helpful. So I know Chess does some very specific outcomes measurements, and I'll pass it over to Hans to talk about that.
Yeah, I'm excited to hear about that.
Yeah, well, real briefly, I mean, we track engagement in the form of, how active are people in an alumni's program and in using our app. But the key thing we do is actually capture really great data from them, both on a daily basis in terms of asking people to answer on a daily basis their confidence in their recovery. And then every week and every month, we use survey tools to really capture data on their recovery progress. So we use an adapted version of the Brief Addiction Monitor survey every week. And one of the things we're able to do with that is measure recovery improvement, strengthening recovery skills. And in particular, what we measure is the decline in risk, relapse risk factors. But we also support the full version of the Brief Addiction Monitor survey, which a lot of facilities like to use on a monthly basis. That's an recognized industry standard in terms of measuring how people are doing in their recovery and their recovery capital. So that's one of the principal ways, and then obviously we can measure sort of their engagement in the app as another metric.
Mm-hmm.
And I want to just tag on to that because every chronic illness has vital signs and things that they use to measure how somebody is doing. The substance use disorder field doesn't have as many of those. There's a few, but there's not that many, and really working hard to move towards having that feedback informed treatment and having actual metrics and measures. So I think it's so critical that platforms like Chess can actually have measures in place to see where someone's progressing or struggling, just like we would if we measured someone's blood pressure or took someone's temperature. Those vital signs that we have on the medical side, we're moving those into the behavioral health field in more robust and evidence-based ways that I think is so critical. And so having that integrated into what Chess is doing is key. Now, there's some treatment centers that are able to do that, but many don't have those kinds of resources to track that kind of data, and then to marry it back to the patient, and then to see, okay, how are our outcomes? And having CHESS be able to do that for them is another burden that they can help lift off of a treatment center that wants to track those outcomes but might not have the resources to do it.
Awesome. Great information, guys. What incentives or gamification techniques have you found to be effective to spur ongoing participation in sobriety?
Sure. Well, I'll share that, one in our app itself, we use points, levels, badges, things like that to promote positive use of the app, sharing achievements, completing CBT modules. The more people participate in community, they can earn badges related to that. They can earn badges for answering surveys, for journaling. But we also support contingency management. And that's a new, evidence-based approach to really complementing actual therapy using rewards, cash rewards, or in our case, a debit Visa card rewards. And in that case, by the way, you can't, the contingency management can't be limited to app-based incentives, because you want contingency management to work for all of your patients. So actually, and that goes back to, we're actually more than just an app company. We've also got a whole platform for managing contingency management, which might be rewarding people for things that happen, in clinic. It could be for rewarding people for a negative urine drug screen. And those are things our app doesn't touch, but we automate and make really easy to manage.
I appreciate your time, Hans. I know you gotta get out of here, so I don't want to take too much more of your time. I do want to give you a quick platform. If there's anything that I've missed that you really want to get out, here's your chance. If not, man, we really appreciate your time.
Well, I guess the only thing is, I'll say that as excited as we are about our technology and as hard as we worked at that, the secret sauce of CHESS Health is our peer team. We have an amazing team of peer recovery support specialists who support the individuals who use our app. And I'll tell you, for this to work, you've got to have a software plus human combination. And our real life humans, they're amazing peers. They'll never be automated with AI. They are the ones who bring life to our solution and who deliver amazing recovery outcomes for the people who use our app every day. And so that's what I'd love to highlight.
Awesome, Hans. I appreciate your time so much. Again, CHESS Health does partner with Lightning Step. You can contact CHESS Health, or you can contact Lightning Step to see what that integration looks like and how we can provide that in your facility. So again, I know you got to head out, so I really appreciate your time. We can let you go, and I'll wrap up with Janelle here.
Great.
But thank you so much for your time.
Bye, everybody.
All right, Janelle, I'm going to wrap up with you as well. I want to give you the same question that I posed to Hans. Is there anything that I've missed or anything that you really want to get out here while you have the podium? Please take it away.
Thank you. I think I would wrap up by saying that there's a lot of different things you can do with your alumni, but the key is to find the thing that works for them, interests them, and excites them. So you can do a lot of different things, but if it isn't sticky, if it doesn't make them want to come or want to do it, they won't do it and it won't work. So, and this is true for any disease management, any chronic illness management effort out there for any disease state, that the hard part is keeping people engaged. If you can't keep them engaged, if you can't get them involved and engaged, it will not work. So some of the things we were talking about with contingency management, with the social aspect of it, that's super important. Being able to see progress, those are things that are sticky. Being able to get points, those are the things that that need to be built into whatever alumni strategy you use. How do we get people excited and engaged, keep it fun, keep it easy to access, lower the barriers, and just keep people involved and keep them in a social context so they're not isolated and they're not alone. That in and of itself will improve outcomes and help people stay in recovery for longer and hopefully in lifelong recovery.
And that's what we're all here to do, right?
Right.
Right, yeah. So it's been another educational and informational conversation here on the Lightning Step Couch. Again, we had Hans Morefield was CEO Chess Health, and we had Janelle Wesloh, former VP of the East Region and of Clinical Excellence, Innovation, and Recovery Management at Hazelden Betty Ford. Thank you for joining us. I appreciate all of your time today.
Thank you.